I did my intervention on reducing uncontrolled interverbal behavior in developmentally disabled adults or adolescents. Basically, in Skinner's verbal behavior book in 1957, he described interverbals as a response to a verbal SD, and it doesn't have point-to-point correspondence. In this case, I'm talking about interverbals in the form of answering questions in this intervention here. Weak interverbals could be, the reason for them might be, and rambling is due to deficient stimulus control. And Partington et al. In 1994 found that a participant would pay attention more to the verbal stimulus of what is that, which would block the stimulus control that the visual object or the nonverbal stimuli would have, and they effectively were able to fade out fade in the visual, transfer control to the visual stimulus, and then fade in the verbals there, and so and had an effective intervention. And then also many studies have also found that video modeling has been very effective in teaching participants how they are to respond effectively. Two that I have here would be the McDonald et al., and they used video modeling to teach reciprocal pretend play to children with autism and how to respond appropriately. And LeBlanc used video modeling and reinforcement, and they taught perspective taking in children with autism, and they used adults modeling here. In my intervention, and I'll get more to that later, we're going to use self-modeling of proper interverbal responding to questions. The purpose is to evaluate the effectiveness of textual prompts and video modeling to strengthen stimulus control for more concise interverbal behavior. Basically, we're going to stop so much rambling, and so it's more reinforcing for somebody to start talking to our participants here. We have 3 participants. We have George, Elaine, and Jerry. And I think I changed their names later on, but anyway, this is all done in a small room, and we did use a multiple baseline probe design across participants. Yep, for George, Elaine, and Cosmo. We'll say Jerry went by the name of Cosmo. Anyway, the dependent variables that we used is we just took the duration of the interverbal, so we'd ask them a question, and then we timed how long they spoke till they answered that question that was asked. And then we also took how many during that response were off-topic interverbals and how many were on-topic and related to that response specifically. And the independent variable is a textual prompt. What we did here is we put relevant text pertaining to the question that we asked, and then we held it out for the participant, and we figured is that they would then focus on that textual prompt, and it would help control what they were supposed to answer there, and aid them in staying on task and just getting to the task. And then we could also point if they were getting off behavior in the training, and to focus them back on without saying another verbal, re-asking the question. And we also did video modeling, and we did it of themselves, and basically we recorded their responses during baseline, and then we edited out all their their rambling interverbals, and so they were able to view themselves correctly responding concisely to a question. And then we also took inter-observer agreement by having another observer in there, and treatment integrity. Basically, on our duration of interverbals, you see they all had high amount per minute. Oh, this is interverbal response duration. I guess I should put in minutes here. And in baseline, you see that George would answer a question and it would take him about 7 to 8 minutes. Elaine would take about 8 to 9 minutes. And Cosmo was also around 8 minutes. And then when we started the training, it just gradually lowered. And then finally when we faded out the textual prompt. And the way that we did this was we would shorten, to just the one main point, and then basically and just shorten the words that we put on the textual prompt, and then basically till there was nothing there, and we saw what we could get. And then we had a little bit of trouble with Elaine, but remarkably in the follow-up probes, she did quite well. So my intervention was successful. The next thing that we did make, and I show a graph here, is of the percentage of correct interverbals here in baseline. You can see the dark one right here, the amount of correct interverbals that they all had. And then after the intervention, they were all up in the high 90%, which is more appropriate to a typical conversation, and would make more people more likely to ask them questions, and it would be more reinforcing for their peers to talk to them now. So basically, my intervention has found that it does appear that weak interverbal skills in the form of rambling responses may be corrected by increasing stimulus control of the verbal question. And I did this again through those textual responses, and that this would focus the participants off their covert thoughts of their ramblings, and just how when you're thinking, you have other thoughts that go on. Well, obviously these participants were speaking those thoughts, and that would be very aversive, I guess, to everybody to try to talk to them, as you ask one simple question and then you're stuck there for 8 minutes listening to a response. So the textual cues did correctly channel them into just answering the question at hand, and keeping those covert thoughts out of from being overt. And then also self-video modeling, also again in this case, may help make interverbals be more concise and to the point when answering questions, just by modeling the correct way to have a conversation. And then the big limitation of this is maybe video modeling wasn't needed at all, and the stimulus control and the fading procedure may have been, in my guess, probably just as effective on their own. So another intervention needs to happen where we can maybe parse this out, and find that and find out if it really was the textual control or the video modeling. But my guess is it was the textual control. And there are my references. Thank you very much.